Welcome to the Telehealth and Medicine Today ConV2X podcast series, brought to you in partnership with two distinguished supporters of ConV2X 2025 Smart Technology Transformation in Healthcare. Alex Romanovich, founder and CEO of Global Edge Markets, and Maria Palombini, director and global practice lead for healthcare and life sciences at the IEEE Standards Association. Today's discussion explores the evolving technologies and applications shaping cybersecurity and healthcare. Let's listen in and discover where the market's heading.
Okay, so we all know that cybersecurity is a major challenge in our healthcare system. I mean, no matter where you get your statistics from, like reading the HIPAA journal, there was an average of 1.99, to healthcare data breaches reported each day. That's an average of 360,000 plus health records, right? And 79% of them were due to hacking incidents. That's just one clip of the statistics. I'm sure you can just do some research and find millions more. But the reality is that healthcare data is very appetizing to breachers. And so this is a life we live in. The integration of a connected healthcare system just really exploited and made that even more appetizing. So the more connected devices we have, the more likely we are to get breached. So this is sort of where we are. And now everybody's crying, wow, we have a cybersecurity problem. Well, we've had a cybersecurity problem for a long time, but now it's just because it's so explosive, the problem in itself. People want people to react, meaning we want more policy. We need standards. We need manufacturers to this. But it's sort of now we're playing catch up at an unbelievable pace that it's not that easy. And so this is what we're going to be talking about. The session is more about how we integrate technical standards to support the manufacturers and the regulators to sort of streamline the process, right? If we do security by design. So that's what the whole session's about.
Yeah, absolutely. It is fascinating. And what would you say the greatest vulnerabilities are in this entire ecosystem, if you will, of wearables and IoT devices and medical devices and so forth, and of course, data itself?
I mean, there's so many, right? Just think about the data journey, right? Of going from a connected device on or around your body, goes through aggregator, goes through the internet, goes to a cloud, it's just hitting so many points. And every point in that journey is a potential vulnerability. It's a breach. But when we really look at it, there's different places for it, right? So obviously we know that unpatched devices, unpatched software vulnerabilities, and outdated operating systems are the biggest flag, right? Say we have older systems, they're not obviously secured that well, but we still continue to use them. When I say we, I mean as an industry, right? Then we have obviously human error, right? Password, you still can't believe it. Weak credentials are a real issue. Weak passwords, people leaving them on their desk can be hacked no matter what. We still see this in the healthcare system. And then we have this group area where is lack of security by design. And what I mean by that is essentially how it sounds. When devices are designed, security is not a top priority. What happens is they're trying to retrofit security later, but that's not a perfect fit, right? We're trying to sometimes put a circle in a square or vice versa. And then the reality is that because there's more connected devices, it's an increased attack surface area. So we're battling many things at once. It's not just, if we could just find the one main source of the problem, we could fix it. So, and this is sort of the challenge we face as an industry.
Now, how can IEEE as a standards body tackle something like this? And furthermore, how do you balance innovation with regulation? How do you balance innovation with standards? Is there such a thing as a balance between the two?
Yeah. So when I mentioned the last two vulnerabilities, the lack of security by design and the increased attack surfaces, this is where global technical standards can have a really positive impact. And I'm going to explain one of them, which I am going to showcase at the ConV2X conference. But it really basically, if you follow the technical standard into the design, right, at that point, you're eliminating one, you're streamlining your potential FDA or wherever regulatory approval you're going. And two, you're actually doing it at the point of design rather than later on. It's very hard to retrofit a product later. It's going to cost more money, lose more time. If, obviously you're not following cybersecurity requirements and compliance, you're going to get rejected. I mean, it just has a whole load of things. But from a point of view of, standards, you would think, oh, think about it. Standards could take away the problem, right? No longer as a device maker, I have to invest my time, my R&D time, my engineers' time to figure out how are we going to best secure this, or how are we going to do enough so that we can achieve compliance. If the standard is designed to pretty much harden the device, you just implement the standard. The code is written for you. So this is an example, right? But I give everybody this example because I also hear this comment all the time that sometimes standards can block innovation. All of us have a smart device, correct? And when we go anywhere in the world, we connect to the Wi-Fi. How do we do that? Like, as a consumer, do you do anything other than, go from airplane mode off and on your phone? That device is following the IEEE 802.11 Wi-Fi standard, which allows any smart device to connect to Wi-Fi anywhere in the world. The code is embedded in the device. So what I'm saying is that it's seamless to us as users, right? We go ahead and we use a device. Think about it. When 802.11 was released more than 20 years ago, look at the amount of innovation that has come after that, right? Think about your smartphones, your iPads, the amount of apps, the ability for us to do connected healthcare or connected anything, connected vehicles, all these other things. Standards pretty much mitigates the barriers to innovation, right? It's not designed to hold it back. You're supposed to build off of it. And that's really the opportunity here. And if we bring it into healthcare, cybersecurity is one example. If we take out the challenge of cybersecurity, which impacts everybody globally through standards, where can innovation go more? Where can we put that R&D more towards the product that can better help patients, right? And that's the way we have to really embrace standards differently.
Yeah, and it's amazing because IEEE embraces engineers, clinicians, policymakers. How can you educate and train and collaborate with those entities, if you will, or those roles, so that, innovators build products with IEEE standards in mind, or clinicians use it, or at least educate themselves on how they conduct themselves safely. And policymakers also build that into the laws, into the policies as well.
Yeah, it's pretty much, first of all, IEEE's mission is advancing technology for humanity. This is our global mission. This is everything that we do here, whether it's standards development or look into new technologies. It's always is at forefront for us. When we look at the development of standards, first of all, standards are market driven here at IEEE, which means volunteers come to us and say, look, we think we can address this problem through the development of a technical standard. It's not driven by staff like me and say, oh, this would be a good idea for a standard today. And they come together, but it must be consensus based. And what I mean by that is it has to reflect the voices of the individuals or the entities that are going to be impacted by the implementation of the standard. So the people you mentioned, clinicians, regulators, patients, hospital systems, the telecommunication networks, whatever it might be as the code of the standard. But those groups have to work together in order for that standard to, one, be passed, because we want it to be consensus developed, but two, to also be adopted. If a core group is not included in the development of that standard, they're not informed about it. They don't know about it. So it's less likely for them to adopt it. And then what's the point of the standard if it's not adopted? So the idea is for these groups to work together. And we do have regulators working in our standards working groups for two reasons. One is they're obviously bringing their expertise, whether it's from a regulatory policy perspective, but as well as they get educated in the development of the standards so that when it gets published, they can make the decision on whether they want to require it to be written into policy, or they might just recommend it. So, as you know, or they might say, we accept it, but again, it's not required into written policy. So regulators can have different ways in which they say how they want to recognize the standard, but they're not required to do so, right? And IEEE is not we're not in the policy business. We are in the standards development business. And really what we do is educate. Once the standards are developed, we educate what the standards are about, how they can be adopted, and how it's going to improve the outcome of what the standard was trying to address from the beginning.
Excellent. One of the final questions. Let's fast forward to 2030 or 2035, and let's assume that you're a futurist at the moment. What does a secure, interoperable, and standards-based intelligence healthcare environment look like? Tell us.
I would like to say first that we don't have a healthcare breach every day, but I don't know, that might be a little too idealistic. I actually believe that it's going to be a little different. I think we're going to go to a more inquisitive healthcare system, right? We are at the dawn of healthcare consumerism, right? For all of us, that means patients are more demanding, how they want their healthcare delivered, how they want to access it. We want more hospital at home. And the more we start educating patients about these challenges, like today, patients don't really worry about, is my system cyber secure? Is my data going to my electronic health record? Like that's not the norm in patients today, right? We also have generation gaps that also dictate that. But in the next 5 years, I think it's going to become more and more where patients are going to be demanding these questions. And we might have some more solutions, whether in the form of standards or actually industry develops these solutions, where it's more cybersecurity or maybe more policy requires interoperability between devices and electronic health records and whatever it might be. But I think we're going to move to a system where patients are going to be asking these questions when they being asked to use a device, an insulin pump at home for diabetes. Is it secure? Is the data going back to my electronic? Can I access that data? Like, I think we're going to see that trend move forward, which is a good thing, right? Because asking those questions, an empowered patient has more chance of addressing their healthcare challenge than a less empowered patient, meaning having access to the data, having the ability to use it and go visit the specialist they need and transact with that data the way they need to do so. So I find that 2030 might be a more inquisitive, patient-driven, inquisitive healthcare system, in my opinion.
And potentially helpful in the sense that, for example, I spent a lot of time in elder care and the mental health, but also helpful to those who are not necessarily able to navigate this fairly complex environment, or something that could be automated. Maybe it's part of a wearable device, maybe it's part of something that's local and protected. Wouldn't you say so?
Absolutely. And you hit on a very important point because the aging is the fastest growing population globally. It's outpacing right now already in 2018, the amount of older people outpace children under the age of 5. So we are going towards a rapidly growing aging population, again, with varying levels of digital literacy, right? Like some are really digital literate, some are not. And so we're dealing with this connected digital future healthcare system. But the reality is that they're going to start to ask the right questions too, right? They don't want to be, they want to have the right to age, with dignity at home and not be, constrained to live in an assisted living facility. But that's going to require them using some of these connected devices in order to like maintain some, quality of life at home. And they're going to be asking all these questions. Again, this is sort of like we're in a transition, right? We went from a transition of a paper-driven healthcare system, right, to a digital healthcare system. And we still haven't really gotten completely out of the paper healthcare system, right? There's still some doctors who love paper, right? And so they have a transcriber. So we're on that sort of, sort of that transition. And I think in those 5 years from now, we're going to see that other transition from the patient being more inquisitive, more demanding, more when it comes to these critical things. And the aging is going to be at the forefront because the reality is that we have a rapidly growing aging population that we, as a healthcare system and as a society, we have to get ready for.
And on that note, Maria, thank you so much for being with us. We're looking forward to seeing you at Conv2X and tuning into your talk on cybersecurity and healthcare. Thank you so much.
Thank you. This has been
Thanks
really
for
fun.
tuning into this episode of TMT's Conv2X Partner Podcast Series. We extend our appreciation to our partners, Maria Palombini and Alex Romanovich, for their steadfast support of Conv2X Smart Technology Transformation in Healthcare 2025. To explore thought leadership and support opportunities for Conv2X 2026, contact the publisher at t.ce at partnersindigitalhealth.com. Stay up to date on Conv2X 2026 at telehealth.conv2xsymposium.com. That's telehealth.conv2xsymposium.com. Thanks for listening.